Hello, sir. My name is Hany Elosman. I'm the head of computational medicine and emerging technology for NEOM project in Saudi Arabia. I'm a clinician in clinical laboratory medicine with focus in hematology and immunology. But I've decided that that was so boring, so moved into clinical informatics. And that's what I've been doing and what I'm passionate about.
Hello, my name is Irene Solaiman. I'm the head of global policy at a company called Hugging Face, which is working to democratize good machine learning. And I formerly started bias research and led public policy at OpenAI.
So the whole focus of NEOM healthcare and health and well-being is to focus on proactive prevention than the traditional sick care. Every single country, every single organization that I know of, we've been working on how to make sick care more efficient, less costly, but we have never really explored the potential of how we could proactively prevent people from getting sick, or at least manage them in a longer duration of time before they go into the sick care system. This is the aspiration for us in the division, in the department, in the sector. And our CEO and our boss, exactly, this is their mandate. Let's focus on something unique, new, that can accelerate to the human progress, not just NEOM and the world at all, by giving us the opportunity to work on science, work on smart city design, work on environmental factor, because healthcare in general by itself is not a sustainable system. So you must complement that with environment, with urban planning, with regulations, policies, as well as innovation.
Hugging Face it's one of the most popular platforms for sharing artifacts such as models, data sets, and easy to use interactive spaces for engaging with AI systems. And it's truly global, where this is part of the mission to democratize AI. People from all over the world can contribute and learn from AI artifacts.
I'll tell you this. I used to tell my students these questions. They ask me these questions about data privacy and data security and data this and data that. Here's the deal that I will tell you. If you ask any patient before and after he get diagnosed with the disease, before, he doesn't want to share information. After, he wants to share information with everyone, including the milkman, if he thinks that he or she may have some sort of treatment for them and that will help the cause. So we said, well, how about we do this? We don't want to take your information unless you give it to us. But we have to demonstrate to you the value of you sharing your information with me by giving you an integrated system between you, your provider, and the system that makes you feel the value of every ounce of information that you volunteer and give us. That's the whole design of a new system that focuses on proactive prevention. It's voluntarily. If you give me 10% of the information, I will give you 10% predictability. If you give me 60% of the information, I will give you 60% predictability. But at the same time, once I get these data, once I get this information, I'm the custodial, so I have to make sure that it is safe, secure, and only remain safe and secure till you, the owner of the data, have access to terminate it or repurpose it.
Cultural value alignment is just a huge research question, and it's under this umbrella of AI safety. Part of what is so motivating is because there are so many different work streams to content provenance. So making sure that we have verification of what is AI generated or human generated, synthetic or real in those senses, down to whether a system performs best in different languages, such as non-Latin character languages outside of English in Western Europe. So I think part of why it's so exciting is because you never run out of challenges, you never run out of work, and cultures are evolving, our society's evolving, so we have to continually reevaluate our goals.
Symbiotic relationship. So in a symbiotic relationship, both parties benefits. Most of the conversation right now is about how we can enrich the artificial intelligence and train them and make them better, but we've been forgetting about the human. And so one of my biggest fear in the planet is that the movie Terminator happened in reality, where we have spent all the time, effort, and money to train some engines, and we forgot about the human, which is the core essence of this entire ecosystem.
This will evolve as AI systems become more powerful, more capable, where we are, and this is part of being able to adjust to the rapid pace of the integration of AI systems. Part of what I said on stage was, how do we ensure that systems are supplementing and not supplanting? We need to understand how different sectors, expertises work with the tools that are tailored towards that task, and also understand those labor impacts. What is appropriate compensation for a worker, for a person, to be working with a system? If they're putting in more work hours, how do we measure productivity? These are all many different evaluation metrics.